You notice it in the pauses, the sudden struggle to find an everyday word, or the confusion that sets in on familiar roads. Major neurocognitive disorder, what most of us call dementia, is a measurable decline in memory and thinking that actively disrupts daily life. It is never a normal part of getting older. The immediate response is medical. Physicians and neurologists step in to map the decline, run diagnostics, and treat the physical changes happening inside the brain. Mapping the physical brain is necessary, but an entirely medical approach can leave the household without its own clinical safety net. Let's look away from the primary diagnosis for a moment and look at the person managing the logistics, the person driving to those clinical appointments and calmly answering the same question for the 5th time in an hour. Operating outside a structured support system, the emotional weight of this role accumulates quickly. The daily repetition breeds a profound, quiet isolation. The traditional circle of care focuses all resources and specialists on the primary patient. The caregiver exists completely outside this professional boundary. Left outside, predictable conditions settle in. Chronic stress, clinical depression, and severe anxiety wrap around the isolated caregiver, compounding daily without treatment. When a medical strategy focuses solely on the diagnosed patient, the immense pressure on the family unit remains unaddressed and untreated. Caregivers often experience a specific psychological phenomenon known as anticipatory grief. It is the process of grieving the loss of a loved one whose physical body is still sitting right across the table. This is a continuous cycle of unresolved loss. It creates a baseline of ongoing trauma that standard neurology checkups simply aren't equipped to process. Processing that trauma requires specialized therapy. It provides the steady footing families need to navigate a reality that shifts almost daily. But there is an obvious logistical wall here. If you are already managing extreme daily burnout, adding a 40-minute commute for a therapy appointment is an unrealistic request. Any psychological intervention designed for this demographic has to be frictionless. Otherwise, the support itself becomes another exhausting chore on the checklist. Coping and Healing Counseling, or CHC, was built to eliminate those traditional barriers to mental health care. By operating through a secure, HIPAA-compliant telehealth model, they erase travel time. The clinical space comes directly into your home. Covering all 159 Georgia counties, CHC connects patients with 15+ licensed therapists statewide. Financial barriers are minimized. This chart highlights the $0 Medicaid copay and $10 to $40 tiers for major insurers like Aetna, Cigna, Blue Cross, United Healthcare, and Humana. Their licensed clinical social workers and therapists carry specialties that match the caregiver's burden, specifically treating anxiety, depression, PTSD, and grief. By removing the commute and lowering the cost, CHC provides a specialized support system designed to fit into a caregiver's life. There is often a profound guilt associated with looking away from the primary patient, but securing an hour a week for your own mind is not abandoning your loved one. Psychological support is a survival mechanism. You cannot sustain effective caregiving if your baseline is collapsing. You are fully allowed to need support too. You do not have to carry this weight in silence. You can initiate care tonight. Go to chctherapy.com or call 404-832-0102 to connect with a specialized therapist. Watching someone you love navigate neurocognitive decline is one of the hardest things a human being can endure, but the structural support to help you navigate it is ready.